The Committee on Homeland Security will come to order. Good afternoon. First, on behalf of the members of the committee, let me welcome our panel. The purpose of this hearing is to examine the broad range of issues surrounding how our nation provides housing for disaster victims. Specifically, this hearing will provide members of the committee with the opportunity to discuss the unprecedented challenges facing federal, state, and local governments in their efforts to house the victims of Hurricane Katrina and Rita, access to safety and effectiveness of current emergency housing programs, and examine the plans being developed to ensure that our nation will better prepare to meet the future housing needs of disaster victims. Nearly 2.5 years after Hurricanes Katrina and Rita struck, the people along the Gulf Coast are still coping with its aftermath and struggling to recover. In order for our nation to truly be resilient, the lessons we have learned from this catastrophe cannot be ignored. One of the most striking lessons we learned was this country was ill prepared to provide emergency housing to victims of a major catastrophe. To house the number of individuals who lost their homes during Katrina and Rita, FEMA was forced to immediately purchase thousands of travel trailers. By the time the dust settled, FEMA had purchased over 100,000 of these units. However, as months and years passed, it became clear that travel trailers may not have been the best option. As early as April of 2006, concerns were raised publicly about high levels of formaldehyde in many of the travel trailers provided by FEMA. Medical experts have stated that the negative health effects from prolonged exposure to high levels of formaldehyde can range anywhere from respiratory irritation to cancer. After pressure from Congress, health experts and community organizations, FEMA announced that they would enter into an agreement with the CDC to test the trailers for formaldehyde and to study what associated health impacts may have been encountered. However, it was not until December 21, 2007, that the CDC actually began testing formaldehyde levels in travel trailers and mobile homes. That is over 1.5 years after the first reports of high formaldehyde surfaced. This delay is unacceptable. I look forward to getting a clear explanation from both FEMA and CDC as to why testing was delayed so long. Even more troubling is a recent discovery that FEMA directed the CDC to not investigate or communicate the health effects associated with prolonged exposure to formaldehyde. The committee recently came into possession of internal CDC emails, which shows that despite the efforts of CDC professionals to bring these health risks to the public's attention, those concerns were thwarted by CDC leadership for roughly 8 months. I hope that our witnesses can shed some light on this issue by explaining why FEMA directed the CDC to exclude discussion of the long-term health risk and why the CDC complied. In addition, while I'm pleased that the testing of air quality has finally commenced, I worry that the damage may have already been done. I look forward to hearing about FEMA and the CDC's plan to monitor and treat the long-term health effects of people who have lived in FEMA trailers or mobile homes in the Gulf. While we can't turn back the clock to prevent this debacle, we can make certain that this problem will not be encountered during future disasters. That is why I, along with some of my colleagues on this committee, introduced a Safe and Healthy Emergency Housing Act to protect disaster victims by requiring that any emergency housing units provided by FEMA meets HUD regulations limiting formaldehyde emissions. Finally, in the aftermath of Hurricanes Katrina and Rita, Congress allocated billions of dollars through the Community Development Block Grant Program to the Gulf Coast states to address the housing and infrastructure needs. I look forward to hearing how the funding is being allocated by HUD and how effective the states have been in using the money to help the victims of these disasters. Specifically, I'm interested in learning why HUD has yet again waived the low-income regulations associated with the Community Development Block Grant Program so that the state of Mississippi approved a diversion of nearly $600 million intended for housing relief to go to a port improvement project. I want to thank the witnesses again for their testimony. The chair now recognizes the ranking minority member of the committee, the gentleman from New York, Mr. King, for any opening statement he may have.
Thank you, Mr. Chairman. Thank you for yielding. Thank you for calling the hearing. Mr. Chairman, at the outset of today's hearing, it's important to note that a number of the issues that you've outlined in your opening statement, I think also are traceable, at least in part, to the fact that there's such a multiplicity of jurisdiction in the Congress. There's been at least 3 other committees and subcommittees. The House of Representatives have held nearly a half-dozen hearings on disaster housing over the last several years. And this, again, to me, underscores the point that we have to be doing much more to consolidate jurisdiction in one committee, ideally this committee. That certainly is in keeping with the congressional charter. And so we have to, I think, dedicate ourselves to doing more to get that jurisdiction consolidated so that the duplications we see here, the lack of consistency, can be better addressed. Also, Mr. Chairman, I would like to take this opportunity not to start off the year on an unharmonious note, but to underscore the fact that we have learned on our side that you do not intend to pursue an authorization bill this year. And since this is the first hearing of the year, I think it's appropriate to make our point clear at this time that we think that is a serious mistake for the committee. We think it's a serious mistake as we attempt to consolidate our position in the House that your decision not to pursue an authorization bill. We had one in 2005, we had one in 2006, we had one in 2007. We think it would be a serious mistake not to do it this year. Realize that there are crowded schedules. Certainly we faced that in 2006, where we addressed a lot of issues, but still did find time to do the authorization bill. Whether or not the Senate does it, I don't think we should be just concerned by what the Senate does. I think we have a message to send to members of our own body here in the House. That's why I would ask you to reconsider that as the year goes along. As you recall, last year in 2007, when you were the chairman and did a fine job as chairman, we actually worked very well together on an authorization bill. My memory is that it passed either on a voice vote or by a unanimous vote, and I thought it sent a very strong and clear message to the House. So I would urge you to reconsider that as we go forward this year. And with that, I look forward to the hearing today. Yield back.
Thank you very much, and I assure the ranking member that as we go forward, time permitting, we'll have that discussion, and you might be pleasantly surprised.
I always look forward to discussions with the chairman.
All right. Before I introduce our panel, I'd like to ask unanimous consent to submit 4 documents for the record. The first is an email from Dr. Chris DeRosa, a former director of toxicology at CDC, to high-ranking CDC officials, citing concerns about a February 2007 health consultation prepared at the request of Fema. The second document is a June 2007 email from Dr. DeRosa, again raising concerns regarding the lack of discussion about long-term health risks. The third document is CDC's October 2007 updated health consultation. This report addressed many of Dr. DeRosa's concern, but it has been given very little attention in public health settings when discussing the health risk of formaldehyde exposure. And the fourth document is a letter I sent along with Chairman Waxman of the House Committee on Oversight and Government Reform to FEMA in April 2007, raising concerns about the health risks posed to individuals who choose to purchase travel trailers.
Mr. Chairman?
Yes.
Reserving the right to object. I'm not going to object. Obviously, there's no need to start off a hearing on that note. But I just would ask, and I have obviously, this has been mainly handled at the staff level, but I believe we were first notified of your intention to do this last evening. This hearing has been in preparation for many weeks now, and I just would ask, to the extent it can be done in the future, that we be given more notice on these issues. This obviously is of some significance. These documents seem to go back quite a few months, and I would ask for, in the interest of having a more coherent hearing and for us being able to prepare better for it, that we receive, whenever possible, more adequate notice in the future. And with that, I withdraw my reservation.
Mr. Chairman? Oh, excuse me. I want to respond.
Yes.
Do you want to respond to Mr. King first?
Reasonable request. I would say to the ranking member, as soon as we get the documents, and if it's deemed that we will use them in a hearing, we'll be more than happy to provide them.
Mr. Chairman,
Yes.
reserving the right to object, which I won't, I also would like the opportunity, this is a controversial opinion, not necessarily a mainstream opinion even, and would like the opportunity to insert after the hearing additional items into the record.
Without objection. Please, if you provide the information, get it to us, we'll include it. I now welcome our panel. We are pleased to have the Assistant Administrator for Disaster Assistance from FEMA, Mr. Carlos Castillo, here to testify. Mr. Castillo came to FEMA in July 2007 after more than 25 years as a firefighter and local emergency manager. Our second witness is Dr. Henry Falk. Dr. Falk is Director of the Coordinating Center for Environmental Health and Injury Prevention at the Centers for Disease Control and Prevention. Our third witness is Mr. Nelson Burgon. Mr. Burgon is the General Deputy Assistant Secretary for the Office of Community Planning and Development within the U.S. Department of Housing and Urban Development. Our fourth witness is Mr. Michael Gerber, who is Executive Director of the Texas Department of Housing and Community Affairs. Our fifth witness is Mr. David Tipson. Mr. Tipson is the Interim Director of the Lawyers of the Community Development Project for the Lawyers Committee for Civil Rights under Law. Without objection, the witness's full statement will be inserted in the record. I now ask Mr. Castillo to summarize his statement for 5 minutes.
Good afternoon, Chairman Thompson, Ranking Member King, and members of the committee. I'm Carlos Castillo, Excuse me. Good afternoon, Chairman Thompson, Ranking Member King, and members of the committee. I'm Carlos Castillo, the Assistant Administrator for Disaster Assistance in FEMA. I have proudly served in this role since July 2007. I am pleased to be here today to discuss our continued efforts to provide assistance to those residents and communities still faced with difficult challenges as a result of the 2005 hurricane season. In light of recent news developments, I would like to address and clarify FEMA's role and actions concerning testing of manufactured housing. First, I would like to begin by addressing some issues that have arisen. I want to be very clear about this. The health and safety of disaster victims is our top priority at all times. At no time did FEMA ever, or would FEMA ever, condone misleading anyone in connection with the health and safety of the people we are dedicated to helping. Any and all allegations that FEMA ignored or manipulated formaldehyde-related research are unfounded and false. Such activities are completely contrary to our mission and our commitment to the victims of disaster. When FEMA first began to receive reports about formaldehyde concerns from occupants of travel trailers, the agency responded immediately to each one. However, as the number of complaints began to increase, the agency started to realize the potential scope of the problem. Since that time, FEMA has developed and is implementing a multifaceted approach that focuses on helping occupants move to more appropriate housing. While nearly 2.5 years have passed since the devastation of Hurricanes Katrina and Rita, FEMA continues to aggressively honor the administration's commitment to help rebuild the Gulf Coast. We have faced innumerable challenges along the way, challenges that have tested capabilities and, in many cases, have served as an impetus to reshape and improve how we deliver assistance. In response to Hurricanes Katrina and Rita, FEMA conducted the largest temporary housing operation in the history of this nation, providing temporary housing units at peak to more than 143,000 families across the Gulf Coast. While most of these families have transitioned to self-sufficiency, we continue to support the remaining more than 43,000 households in temporary housing units as they find and transition into longer-term and more stable housing solutions. I have submitted my written testimony for the record, and it outlines a number of FEMA programs aimed at assisting Gulf Coast communities and disaster victims. I'll summarize them briefly. First, the Gulf Coast Housing Strategy Action Plans. We are committed to providing suitable long-term housing solutions to families impacted by these hurricanes. Led by FEMA's Gulf Coast Recovery Office, or GCRO, FEMA continues to work with applicants to ensure they have access to any and every available housing resource that can help speed their recovery. We are pleased that nearly 70% of the households that received temporary housing units following Hurricanes Katrina and Rita have now moved out of these units and back into some form of permanent housing. The work of transitioning the remaining residents presents many challenges as we try to balance available resources with support needs of the families that reach beyond basic housing, but are often just as critical to the individual's ability to return to self-sufficiency. On July 26, 2007, FEMA and the Housing and Urban Development Department executed an interagency agreement establishing the Disaster Housing Assistance Program, a temporary housing rental assistance and case management program for eligible individuals and households displaced by Hurricanes Katrina and Rita. The program is currently being administered through HUD's existing infrastructure of public housing agencies. Ultimately, over 40,000 eligible households displaced by the 2005 Gulf Coast hurricanes will continue to have their rent paid through this partnership with HUD. Recognizing that mobile homes and trailers are not ideal housing solutions, Congress provided $400 million for FEMA to conduct an alternative housing pilot program to identify and evaluate alternatives to travel trailers and mobile homes. The projects include state-of-the-art engineering standards designed to maximize energy efficiency with environmentally sound materials. Once tested and proven, these alternatives could potentially be used in response to future disasters. After a competitive process, pilot projects in Alabama, Mississippi, Louisiana, and Texas were selected for grant awards. In September of 2006, FEMA established a Joint Housing Solutions Group whose purpose is to develop a systematic process to evaluate and rate various disaster housing options, identify viable alternatives to travel trailers and manufactured homes, and recommend improvements for conducting housing operations. After the issuance of the July 31, 2007 interim direction suspending the use of travel trailers and park models, FEMA tasked this Joint Housing Solutions Group to identify and evaluate potentially viable forms of alternative housing on an accelerated timeline. I'm aware that the chairman has introduced legislation, the Safe and Healthy Emergency Housing Act of 2007, which requires FEMA-provided housing to comply with HUD regulations. I am pleased to report that all manufactured housing, also known as mobile homes, purchased by FEMA before and after Hurricane Katrina met the regulatory standards enforced by HUD. While HUD does not regulate formaldehyde emission levels of construction materials for park models or travel trailers, FEMA has incorporated this HUD standard for construction materials for any purchases of temporary housing units. We will continue to meet with federal agencies, industry leaders, and health experts to incorporate measures into all units purchased by FEMA to ensure safe and secure housing. In summary, our recovery efforts continue. FEMA has learned from our experiences. We have a commitment to disaster victims that has never wavered, and we are looking ahead. We've embraced a new philosophy. Thank you for the opportunity to testify. I would be pleased to answer any questions you may have.
Thank you for your testimony. I now recognize Dr. Falk to summarize his statement for 5 minutes.
Good afternoon, Chairman Thompson, Ranking Member King, and other distinguished members of the committee. My name is Henry Falk, and I very much appreciate the opportunity to testify and provide an update on the CDC activities related to evaluating formaldehyde exposure and health concern in travel trailers and mobile homes. We are very much committed to doing this work and committing to do it very openly and transparently. CDC is currently completing the fieldwork on a study of formaldehyde levels in approximately 500 travel trailers and mobile homes. As you know, we briefed congressional staff, public, and others before the fieldwork began in early December. We hope to do the same as soon as the results are ready to brief everybody, do it very openly in late February if all goes well. And we'll similarly provide a detailed briefing to this committee and others. In addition to the study on the occupied trailers, This is one of a number of studies that are detailed in the written statement. And I will try not to go into all of those right now, but happy to answer questions on all of them. We're also looking at unoccupied trailers and engage in studies and developing studies to look at the health of children who have been exposed to formaldehyde. All of this is in response to a letter from Administrator Paulson to Dr. Gerberding on July 13th, 2007, requesting assistance and joint effort working on this. In view of much of the public discussion over the past day, I want to recognize that this hearing takes place in the context of that earlier work, and I would like to comment on this, express my willingness today and in follow-up to this hearing to help the committee address the full range of issues related to this. I've worked at CDC and ATSDR for 36 years. Anytime there are questions raised about the independence of our work, this is a great concern to me. So I'd like to address briefly this prior ATSDR health consultation, as I'll refer to it, and recognize that there were issues related to that, talk about the key lessons that we have learned and the important steps going forward. And I think that the lessons learned are certainly reflected in the work that we are currently doing. Very briefly, that work relates to a request that came through the Office of General Counsel at FEMA to staff scientists at CDC requesting an evaluation of data that had been collected by another agency in 96 unoccupied trailers. There was a report that was a health consultation released in early February. There were clarifications given afterwards, and then ultimately a revised health consultation issued in October. I'd like to contrast in terms of my own understanding of this situation between what we're doing currently, the prior health consultation. The current effort resulted from a letter, invitation from a request from Administrator Paulson to Dr. Gerberding for assistance. It engaged senior staff. It asked for a broad look at the issues, involved CDC design of studies, involved briefings, and I trust transparency in what we are doing. Prior effort resulted from what I think was a narrowly construed request from Office of General Counsel to non-supervisory staff, which persisted in a narrow context for some time. Later on, it engaged senior staff. It involved some of the correspondence which you have noted, and attempts were made to correct any misimpressions related to that, but I think it's very different than the current effort. I would like to say that what we have learned from that prior ATSDR health consultation that we are utilizing in the current effort. We are fully cooperating with all congressional inquiries. We have looked at our own internal efforts within the agency in terms of management of clearance procedures and supervisory procedures. We were concerned about direct requests from Office of General Counsel to staff, and I wrote to Administrator Paulson about that, felt that those kinds of requests should go through CDC General Counsel. We've undertaken affirmative outreach to the community, Congress and public and others on all the work that we're doing, and feel that we must maintain a broad view of our responsibilities and address the holistic concerns. So I hope that we have reasserted the kind of important role that CDC ATSDR can play in designing and executing studies in an open and transparent way and applying this experience in our current effort. We have only one interest going forward, and that is to do the best possible job, working closely with you, the public, and the travel trailer residents in a very open and transparent way, doing whatever we can to evaluate the formaldehyde exposures and help people in decision-making and prevent any potential for health concerns. Thank you, Mr. Chairman.
Thank you for your testimony. I now recognize Mr. Gerber to summarize his statement for 5 minutes. I'm sorry, my statement, yes, sir.
No
my
problem, sir.
Comments are different. Go ahead.
You bet. Good afternoon, Chairman Thompson, Ranking Member King, distinguished members of this committee. My name is Nelson Bragon. I'm the General Deputy Assistant Secretary in the Office of Community Planning and Development, with the U.S. Department of Housing and Urban Development. I will specifically discuss how the 5 states in the Gulf Coast are addressing their housing needs and the programs they have proposed to ensure safe and effective housing for residents impacted by Hurricanes Katrina, Rita, and Wilma. In response to the disasters, the President signed 3 supplemental spendings under the CDBG funds. The first CDBG supplemental provided $11.5 billion, and this supplemental appropriation was signed on December 30th, 2005. Within 1 month, Secretary Jackson allocated these funds based on the areas of highest needs and with the greatest concentration of destruction. In June 2006, the President signed the second CDBG supplemental, providing an additional $5.2 billion, and Secretary Jackson again promptly allocated these funds to the affected states. The third supplemental, most recent, was signed in November of 2007, and this supplemental provided an additional $3 billion specifically for the state of Louisiana's Road Home Homeowner Assistance Program. To date, almost $20 billion has been appropriated for CDBG grants to assist the states of Alabama, Florida, Louisiana, Mississippi, and Texas, the 5 Gulf states impacted by Hurricanes Katrina, Rita, and Wilma. Of this amount, states have proposed housing programs totaling about $15 billion, or approximately 75% of the total amount appropriated. In a little over 2 years since the first supplemental appropriations, the states have expended over $8.3 billion of CDBG recovery activities and over $7.5 billion of which has been for housing assistance activities. The first 2 CDBG supplemental appropriations acts passed by Congress were very clear in their intent and extraordinary in the flexibility provided to the states, far beyond the traditional nature of such supplemental block grant funding. Congress directed HUD that we shall waive all regulations and statutes which act as barriers for the implementation of the governor's proposed action plans. Only 4 areas could not be waived by the Secretary. These were fair housing, environmental, civil rights, and Davis-Bacon's labor standards. HUD's primary role was to provide technical assistance on the federal program requirements and thereafter monitor the use of funds, but not to dictate uses of funds or the amounts to be set aside for each individual activity, unless otherwise specified by Congress. The eligible states would have complete flexibility in determining the design, establishing funding levels, and carrying out activities to achieve their goals. This approach has allowed each of the 5 states to tailor its recovery programs to best address the needs of the citizens of its state. The state of Louisiana and Mississippi elected to implement a homeowner compensation program. The compensation model provides eligible homeowners with a grant for uncompensated property losses to their primary residence. In consideration for such assistance, homeowners would agree to covenants on their property that would require that any new or rehabilitated structure to meet modern building codes and FEMA requirements. Mississippi has assisted over 15,000 homeowners, and the state of Louisiana has assisted over 93,000 homeowners under these compensation programs. As stated previously, each state was given the flexibility to adopt its own recovery plans. The states of Alabama and Florida went with more conventional, implementing a more traditional, conventional program. They distributed their monies to the local units of government, and these units of local governments then did the housing rehabilitation or infrastructure projects. The state of Texas, from the first $74.5 million that they received on the first supplemental, they decided to undertake a housing rehabilitation through its Council of Governments. That program will assist approximately 452 homeowners. From the larger second CDBG supplemental of $428 million, the state of Texas is running its primary homeowner housing rehabilitation assistance program. Under this program, Texas proposes to assist an additional 15,000 lower-income homeowners. One factor influencing the choice of whether a state does a compensation program or a rehabilitation program is the trade-off between time constraints of the environmental review requirement versus greater control of the undertaking. The state of Texas decided to have a greater control over its program and decided to do a rehabilitation program, which entails the state working directly with homeowners through its local units of government, doing housing inspections, doing specifications, contracting with local contractors, looking at the inspection, approving the certificate of occupancy, which is more time consuming. However, it's a program that provides more accountability.
We'll get on with your testimony during some of the
Yes,
questions.
sir. Well, I'll open it for questions then, and we will submit our written testimony.
We'll now go to Mr. Tipton and then to Mr. Gerber for a statement for 5 minutes.
Good afternoon. I am David Tipson, an attorney with the Lawyers Committee for Civil Rights under Law. I would like to thank Chairman Thompson, Ranking Member King, and the members of the committee for holding this important hearing on post-disaster housing programs and for allowing the Lawyers Committee to testify. The Lawyers Committee is a nonpartisan, nonprofit civil rights legal organization that has been in existence for nearly 45 years. The Lawyers Committee and its local affiliate, the Mississippi Center for Justice, have organized volunteer attorneys from around the country and held over 50 free legal clinics to provide assistance to thousands of individuals in Mississippi unable to access the FEMA benefits to which they were entitled. Hurricane Katrina damaged or destroyed over 85,000 housing units in Mississippi. Homes owned and rented by families of low and moderate income suffered a significant and disproportionate share of the devastation. Today, many of these low-income families remain in FEMA trailers with nowhere to go. There are 13,022 Mississippi households currently in FEMA temporary housing programs, of which 11,641 are in travel trailers. These figures represent approximately 35,000 displaced individuals as of January 16th. The sheer loss of affordable housing caused by Hurricane Katrina threatens to create an entire new homeless population in Mississippi. This committee is already familiar with many of the problems in FEMA's administration of emergency housing programs on the Gulf Coast, and we thank the chairman for his bill to require that temporary housing units comply with HUD standards for formaldehyde emissions. My testimony will focus, therefore, on two recent issues. First, I want to discuss FEMA's failure of coordination with local governments. In the last 9 months, FEMA's ability to provide direct housing assistance to hurricane survivors has been compromised by the actions of local jurisdictions. Beginning in May of 2007, the cities of Pascagoula, Gulfport, Ocean Springs, and Bay St. Louis have taken local action to eliminate FEMA trailer parks and even single FEMA trailers on private property. Even though FEMA has committed to providing direct housing assistance through March of 2009, these local governments have refused to extend local permits accordingly. At the same time, local jurisdictions continue to receive financial assistance from FEMA through its public assistance program. These local governments often cite a need for trailer residents to become self-sufficient. The reality is that most residents could have no greater incentive to move than the FEMA trailer itself. Cramped, uncomfortable, toxic with formaldehyde, and utterly vulnerable to the next hurricane, FEMA trailers are places that people live only when they have nowhere to go. FEMA was not prepared for this foreseeable set of circumstances and has failed to take proactive steps to address this growing problem. The second issue I want to discuss is the rocky transition to the Disaster Housing Assistance Program, or DHAP, administered by HUD. This fall, FEMA began transferring responsibility for rental assistance for Katrina victims to HUD under DHAP. The program was scheduled to begin assisting FEMA trailer residents this month. From the beginning, the transition from FEMA rental assistance to DHAP has been troubled. In a shocking number of cases, HUD officials discovered that FEMA's data on eligible households was outdated, incomplete, inaccurate, or just missing altogether. We have heard accounts of landlords receiving DHAP subsidy checks from tenants who had moved. Many landlords who are willing to accept checks from FEMA-eligible households are not willing to participate in DHAP. Many families who are receiving FEMA rental assistance find that their current apartment will not pass DHAP's inspection requirement. At the same time, landlords who initially agreed to participate in the program are becoming frustrated with late rent checks and other bureaucratic hassles. Tragically, many families who found an acceptable apartment, convinced a landlord to participate in the program, and successfully entered DHAP are now receiving notices to vacate from their landlords because the local housing authority was late with January rent. This gives rise to a particularly unfortunate situation. If the landlord is unwilling to release the family from the original lease, the family will become ineligible for further DHAP assistance. One woman came to our workshop whose landlord decided not to participate, but also refuses to let her out of her lease, which has onerous early termination penalties. As a result, she cannot move to a different rental property, and this woman is now at risk of losing her assistance, her only means of paying for housing. One of the reasons landlords are wary of participating in DHAP is inherent in the structure of DHAP itself. Beginning 1 month from now, rental assistance provided by DHAP will be reduced by $50 each month until it is eliminated altogether. This reduction schedule treats rental assistance as a form of dependence from which recipients need to be gradually weaned and bears no relation to the financial realities of Katrina survivors living in disaster areas. In conclusion, we urge FEMA and Congress to explore ways to address the shortcomings identified in this testimony. Mr. Chairman and members of the committee, thank you again for the opportunity to testify. I look forward to answering any questions.
Thank you very much. And Mr. Gerber, obviously, we've been looking forward to your testimony. Please.
Thank you, Mr. Chairman and Ranking Member King. I'd also like to acknowledge Congressman Cuellar and Congressman Green and certainly Congresswoman Jackson Lee for their leadership in trying to secure funds for the state of Texas to help those survivors of Hurricane Katrina who are living in Texas, as well as those who are dealing with the physical destruction of Hurricane Rita. My name is Michael Gerber. I'm the Executive Director of the Texas Department of Housing and Community Affairs. TDHCA has been designated by Governor Rick Perry as the lead agency in Texas responsible for Hurricane Rita recovery. Thank you for inviting me to update you on these efforts. I'd like to start by saying that TDHCA is clearly not a first responder agency. Rather, we are Texas's lead agency responsible for affordable housing, community, and energy assistance programs. The Disaster Recovery Program was assigned to TDHCA by the governor because local communities and officials identified housing as the overwhelming need after Hurricanes Rita and Katrina impacted Texas. With the first allotment of federally appropriated funds made available to Texas in May of 2006, which was $74.5 million, we worked closely with and listened to local elected officials, community leaders, and faith-based organizations. We clearly heard the message that because the funds were so limited, local governments wanted to be directly involved with their distribution so that they could maximize these dollars. TDHCA utilized local councils of government, which are organizations made up of local elected officials and key staff that serve as a regional planning board. There are 3 councils of government in Southeast Texas that we contracted with in July of 2006 for the distribution of $40.3 million in housing funds, which came from that $74.5 million appropriation. These councils of government are responsible for identifying and qualifying eligible families for help and then hiring contractors to make emergency repairs or rebuild a home or replace a manufactured home. The balance of the $74.5 million is being used for infrastructure repair throughout Southeast Texas, including fixing water and wastewater systems. Given the funds available at the time, we believe that working through the councils of government would allow local governments to weigh the needs of all the residents of the region and provide the greatest impact. In all instances, the intended beneficiaries of these funds are the lowest income Texans, those at well below 80% of area median family income, and we've given priority to seniors and persons with disabilities and other vulnerable populations. It's important to note that Texas identified over $2 billion in need in the region from both Hurricane Rita direct damage and Hurricane Katrina needs, with the flood of over 400,000 evacuees that Texas welcomed with open arms. That is why we also welcome the second appropriation of funds by Congress, which raised our total allocation of disaster funds from $74.5 million to a total of $503 million. That gave the state about 25 cents on every dollar of documented need. However, the second round of funding, $428.6 million, was not fully available to Texas until just 10 months ago. The state has had to make tough choices about how to help communities recover. Again, after much discussion with local officials, community groups, and faith-based organizations, we chose to continue on the path of assisting individuals and communities by focusing on recovery of the tax base and people's lives by focusing on actual housing and infrastructure construction. Building a home, repairing a home, and replacing a manufactured housing unit takes a greater amount of time than qualifying someone and issuing a check to cover their storm damage. Again, Texas chose, because of our limited funds, to do a rebuilding program and not a compensation program, which other states have opted to do because of their more generous allocations from the Department of Housing and Urban Development. Also, because of the limited funds available, we had to tell people who had already rebuilt that we were going to assign first priority to those who could not rebuild without government help. The decision to undertake a rebuilding program caused us to move more slowly than we had wished in qualifying residents and ensuring that they were eligible for the program. Qualifying residents has been a challenging process, but you should know that the state of Texas has added no additional requirements. The factors causing many of the delays, environmental clearances, historic preservation requirements, floodplain requirements, and duplication of benefit restrictions, are all requirements of federal law or HUD rules. We've received tremendous assistance from Assistant Secretary Burgone and his staff to navigate some of those issues. I expect that we will have all housing funds from that first round of $74.5 million distributed and homes built by Labor Day. Most of the work we're doing are full rebuilds of homes, and we expect that for the $40.3 million in housing funds, we will rebuild or replace about 500 homes. For critical infrastructure in round one, again, mostly water and wastewater repair projects, these projects will be completed and all funds drawn down by October. For the second round of funds, the $428.6 million that we received authority to draw down on in April of 2007, TDHCA has awarded all of those $428.6 million. It took some time because several of the programs were competitively run and required communities to submit applications and to be judged on the number of low-income persons who could benefit or be helped. In the case of the Homeowner Assistance Program, for which $222 million has been dedicated, TDHCA is used a competitive bid process to select a group of contractors to help the state to expedite the delivery of funds to qualified homeowners and to build homes and make repairs. We expect the second pot of money, since we've navigated the minefields on the first round, to move more quickly. In the interest of time, let me say that we certainly welcome the committee exploring the capacity of first responders to a major disaster and asking tough questions about who should have ultimate responsibility for the inevitable longer-term recovery. In Texas, we have done some things very well. When you look back at our program, I believe that you'll find strong accountability and controls that the Assistant Secretary alluded to, and no instances of the widespread fraud, waste, and abuse that have plagued other disaster recovery programs, as has been reported in the press. You will also find that our program actually built homes and repaired infrastructure for those whom the program was intended: our lowest income Texans, seniors, the persons with disability, and the very poor. I thank you for this opportunity and be pleased to respond to any questions.
Thank you very much. I thank all the witnesses for their testimony. I remind each member that he or she will have 5 minutes to question the witnesses. It's the intentions of the chair to do questions from the chairman and ranking member before we adjourn for about 20 minutes of votes on the floor, and we'll reconvene after that. Is that all right?
Yes, sir.
Thank you very much. Mr. Castillo, please tell the committee whether or not FEMA asked for short-term and long-term health consequences relative to the issue of formaldehyde in the trailers.
Sir, when we first approached CDC, what we had asked for what were the short-term implications of formaldehyde and what can be done to mitigate that, and that's what the initial report was, and that was the initial request.
Can you, and I'll continue, can you tell me why that came from the General Counsel office and not the Disaster Assistance Directorate?
Sir, I don't know why where it came from at that point, although that was before I was there, but I really can't answer why it came from.
Well, can you get it for us?
I will, yes, sir.
Just for the record, I'd like to say FEMA Administrator Paulson was before this committee on May 15th, 2007. And the question to him was relative to formaldehyde, and I quote, Mr. Paulson said that we've been told that the formaldehyde does not present a health hazard. And that was what we were told before this committee. Obviously, there's a difference of opinion at this point. So is it your testimony before this committee that based on what you received, that formaldehyde is a health hazard to the citizens who may live in them?
Yes, sir, and I have to preface this by saying that FEMA's not a public health agency. We're an emergency management agency, and our role is to coordinate that assistance, but we went to the experts. And yes, after we realized the magnitude and the scope of this problem, which, to be clear, when there was a report from a pediatrician, I believe it was in Mississippi, in the Gulf Coast, who noticed trends in his patients. The day after we learned of that, we reached out to our Office of Health Affairs in the Department of Homeland Security and went to aggressively working towards resolving this issue.
Thank you. What I want you to do for the committee is provide us with a timeline from the initial point that FEMA was put on notice, officially, unofficially, about formaldehyde in trailers, and what did you do? Dr. Falk, can you provide the committee with any other additional information relative to formaldehyde in trailers?
Certainly, formaldehyde in trailers may be a health concern, and I think ATSDR produces toxicology profiles, and they discuss acute risk levels, intermediate risk levels, and long-term risk levels. So I think there are certainly understanding of those effects. I think, as I stated before, in terms of that initial consultation, the focus appeared to the people who worked on it to be on the mitigation factors, and whether air conditioning and ventilation in particular seemed to be effective, and I think that's what they focused on there. I don't think that was meant to be a definitive statement about the potential for long-term health effects.
What?
Joe, just brief.
Go ahead. Go ahead.
This has been known for years and years and years that formaldehyde in these trailers was a problem. This is not something new. I can remember back in the 60s. In the 70s, this was brought to our attention that this was a problem.
Dr. Falk, is it a problem?
And I think that is correct. I think perhaps many people did not perceive the protracted nature of length of stay in the trailers immediately, and the depth of the issues related to Hurricane Katrina, and the fact that there would be long-term stay in the trailer, so that there was potential for long-term.
So did the CDC say to FEMA that the long-term health implications of staying in travel trailers is something that you should not even entertain for victims of any disaster?
I think the difficult part for me, and probably many looking at that original health consultation, is that it construed the request narrowly, responded to the mitigation issues, said that it was not addressing the long-term issues, did not address them. It probably would have been a lot better at that point, have been very explicit. Unfortunately, it focused narrowly on the question at hand.
So are you saying FEMA didn't ask the right question?
I'm saying I think the people who worked on it, for whatever reason, and I can't speak to that totally, but that's the way it was interpreted and construed. They understood that they were being asked about the impact of factors such as ventilation and air conditioning, and I think they didn't, they responded to interpreting the data that they were presented with on the effects of ventilation and air conditioning. I don't think they responded broadly to the broad questions in that initial effort, and that led to some of the subsequent correspondence and revisions to highlight when they understood the limitations, the importance of.
And I'm out of time, and we might get another round in after this. Ranking Member King.
Thank you, Mr. Chairman. I realize we're coming down to a vote, so I'll just cut my question short. But Dr. Falk, you said you've been with CDC for 36 years. From your perspective, did anyone at FEMA try to inappropriately influence the outcome of this report?
As near as I can tell, There was a request to review this information, to look at the data, to analyze it, and the group that responded to that interpreted that in such a fashion that they thought they were responding to the request as it was presented to them. I don't see obvious manipulation or any attempt, based on the requests as I see them. But I think it's really probably important for all of us to fully evaluate those questions and assure ourselves on that. But my understanding, as I look at this so far, would be that the request was interpreted in a way that it was fairly narrow. Don't forget, the group that had been handling this request had been, since the time of Hurricane Katrina, reviewing many such requests to look at data from EPA related to chemical exposures post-Katrina, related to exposures through the debris, and I think they were in that mode, functioning that way, and so thought about the request in those kinds of terms.
I'm not trying to influence your testimony at all, but to me, it would be a very serious charge if FEMA was trying to inappropriately influence CDC. I mean, do you believe it was inappropriate? Were they trying to influence it? Or was this an honest attempt to get an answer, whether or not?
I understand that that would be a very serious charge. I can only say that for me, I can look at this from the CDC perspective and what the CDC people did, and I think that they were trying to, in their terms, respond to what they thought was a very specific request. I don't think I can speak to personally to the intent of FEMA requests and so on. That would be for other colleagues to address, but that's how I view what the CDC people did.
Let me ask
the ATSDR people, I take.
Sorry, go ahead. Okay. Ms. Castillo, let me ask you, did FEMA ever attempt to improperly influence the outcome of this report?
Sir, FEMA would not and did not and would not attempt to unknowingly or knowingly influence the outcome of any report or any direction or any manipulation of scientific information.
Did you ever receive any information that anyone at CDC was pushing back and thought there was improper influence coming from FEMA?
No, sir.
So there was never any complaint or any statement made back to FEMA by anyone at CDC that there was improper influence?
No, sir, and what this came up when yesterday, when we received the letter from another committee to looking with information with other information included, was when we first heard of that, when I first heard of that. And although as an agency, like I said, it's not our mission, it's not our purpose or an intent to ever try to influence unduly or otherwise any report.
Thank you. Thank you, Mr. Chairman.
Thank you very much. Ms. Castillo, mind you, when people ask questions, if it's convenient to say I wasn't around, you do. When they ask another question, you answer it during that same time frame. So I want you to be mindful of the time frame that we're talking about. We're going to recess the meeting subject to the 2 votes, and we apologize to the witnesses. We'll reconvene right after that. Thank you.